This is why today's knee arthritis treatments are keeping your knee in pain. Chances are that the treatments that you're doing right now for knee osteoarthritis are mainstream treatments that are recommended by most doctors, most surgeons. They're treatments that are actually short term and they're not going to provide you good long-term benefits that work on resolving the root problem. So they're keeping you in pain because they're only taking it away for a short time. Now there's a concept here that I want you to understand. There's this idea of the popular mainstream treatments, which tend to be the passive treatments. And then there's the less popular non-mainstream treatments, which tend to be the active treatments. So there's this idea of passive treatments versus active treatments. Your passive treatments are going to be things like getting injections, like your pain injections, cortisone, steroid injections. There's also stem cells now, PRP injections, hyaluronic acid injections. Those are probably the most common. There's some other ones, we won't get into them here in this video. But think about it. You show up to the doctor's office and then they put a shot, they give you a shot, they give you an injection, they put the medication, whatever the treatment is, they're putting it in you. And then you just wait for it to take effect, wait for the body to do its thing, for the medication to do its thing. It's very passive. You can argue there's an active component. You had to show up to the doctor, but let's not go there. For medications, like what you take by mouth, you just wait for the pill to take effect. Like, yeah, you have to take the pill, but then you just wait. There's nothing else that you need to do. Then there's surgery. If you get a knee replacement surgery, which is the most common surgery that's done for people with severe knee arthritis, you show up the day of the surgery, they put you under anesthesia, and then you wake up and everything's done. You have to recover from it afterwards, but think about it. The surgeon and the surgical staff, they all took care of everything for you. You didn't have to do anything except show up. Of course, you have rehabilitation afterwards, and there's some active components to that, but the physical therapists there are very much following protocol. They have a list of things they need to take you through afterwards, depending on limitations and all that, but usually it's going to be improving your range of motion, getting you to walk again, and normalizing you back to your daily activities so that you can recover from the effects of the surgical procedure where they cut you open and replace the joint. They cut off the ends of the bones and put metal parts in there. This is all pretty passive. Now, physical therapy is another treatment that can be done for osteoarthritis in the knee. But general physical therapy, what most doctors will send you to after you show up to their office, and they're going to say, well, let's try some conservative treatments first. Let's try the injection, we'll try the medications, and if that doesn't work, we'll do physical therapy before we go to surgery. Here's why I think that it's mostly passive. The way it's typically set up is you go to the physical therapist's office, and oftentimes it's attached to the surgeon's office, or they have like a really good working relationship. And the reason for that is because the surgeon tends to do knee surgeries, hip surgeries, spine surgeries, shoulder procedures, and they have this great relationship with the physical therapist because that physical therapist or the group, they help the surgeon's patients recover from surgery, meaning that physical therapist or that group of therapists are experts in helping people recover from surgery. Recover from surgery, not avoid surgery. And so if you're trying to prevent a knee arthritis situation from turning into a knee replacement, you're trying to avoid surgery, then why would you go to the therapists that are specializing in recovering from surgery? So the way this is passive is because those therapists that are excellent at helping people recover from surgery tend to just kind of run you through the motions that they would have somebody who had surgery go through. In other words, they treat you like a surgical patient when you're not. There's a whole different process, a whole different specialty that usually they've not gone through. They've not gone through the educational training required to know how to help somebody prevent surgery. And they don't know that there is this. Oftentimes this is like an unknown thing to them. Same thing with the surgeons. Like they don't know that there's specialists out there that help people prevent surgery. And so they don't know to take you through these exercises. So you'll find yourself following the therapist's routine, which is they're going to say, get on the bike, get on the treadmill, do this leg lift exercise, get on this machine, tighten your quads. Wrong thing to do. And if you look around and find somebody else who's had a knee procedure done, they're probably doing like 90, 95, maybe even 100% of the same exercises, activities that you end up doing at the physical therapist's office. So it's passive in that they just tell you what to do when you show up and you just follow orders. Now, let me tell you how the active treatments are. Active meaning you have to learn. You have to pay attention to your body. You can't just rely on another healthcare professional to tell you if this is right or wrong. The way that I go about this when I help people fix their knee arthritis problem, it's a very active thing because it's not just me doing things for them. That's why we can teach people over the internet like this, over a YouTube video, over a Facebook video, over anywhere we put this on the internet. You can learn from this video and help your knee arthritis because you're learning concepts that are important for you to carry over into your day-to-day activities, into how you walk, into how you stand up and sit down, how you get in and out of the car, how you do your chores, how you exercise, how you do all those things. If you make slight tweaks to them, then you can make it work for you to help you prevent your knee arthritis from getting worse and keeping your knees healthy for the long term. But it means that you have to learn and practice. You have to apply what you're doing. The only other healthcare field that I know of that is active like this is the nutritional dietary part of the field. Because if you think about physicians, if you think about surgeons, nurses, most other healthcare professionals, you show up to them and they do something to you. They give you an injection, they tell you to take this pill, they do a procedure for you. You just show up and do what they tell you to do for the most part. But when it comes to curing the root problem that sets up knee arthritis, you need to figure this out. I tell my patients, you essentially need to get a degree in fixing your knee naturally. That's what it comes down to. So you have to swallow that responsibility of, I need to figure this out for myself. And I can't just show up to the doctor's office, I can't show up to the physical therapist's office and expect them to tell me the magic exercise that I need to do to fix my knee pain. Because it's really a process. That's why I say it's like getting a degree. Like just like there's your freshman year, sophomore year, junior, senior year, and at each level you're taking your basics at the beginning, and then you're taking slightly more advanced classes. The 301 version of it. You start with a 101, 301, then you get into your majors, and then you're doing your like internship at the end. You're about to graduate. It's the same process with fixing knee arthritis. It's not just you show up and get told what to do and just do the thing. It's you have to integrate the information into your life. So to give you the straight up analogy, in somebody who's got flared up knee arthritis, when they come into my clinic here, when we work with them online, which we work with people online all the time, we have this knee arthritis recovery program. You can check the link down in the description or find the link around this video somewhere for the knee arthritis recovery program. It's awesome. It's got curriculum on how to guide you through fixing your knee arthritis, but we also offer coaching with this, so check that out. When you're flared up, we show you how to flare it down, and during that time, you can't be doing other stuff. You can't be lifting weights, you can't be doing squats, you shouldn't be doing a lot of walking. You need to just figure out how to flare it down. And it's specific to you. It might mean that you need to avoid certain activities. It might mean that you need to modify things. It might mean you need to get on a cane, and you don't want to. Sometimes we fight with people on that sometimes. After that, then you need to learn how to fire certain muscles. Oftentimes the glutes, the foot muscles need to be turned on. They're not even working for some people, for many people. Then the next level up is how to use those muscles properly in everyday motions. And by this point, you shouldn't be having pain on a consistent basis. It should be just a sometimes thing. Then the last level, your senior level of your fixing knee arthritis naturally degree, needs to be how to lift weights, how to do more extreme activities, how to walk for long periods of time. For some people, they actually get back to running, how to run, how to jog properly with good form, using the right muscles in a way that's not going to aggravate your knee arthritis. That's the final level of this. and it's very, very active. This is not something that you can get an injection for. Stem cells isn't going to teach you all this. PRP injections isn't going to figure this out for you. Getting a knee replacement surgery is definitely going to restrict how much you can do. I mean, you go get that knee replacement surgery, and people don't realize this because I don't know if it's the surgeons don't give this information to you, or maybe it's just information overload. Maybe they are giving it to you, and you're emotionally distressed about the thought of even having to go get your joint replaced, and just accepting that is consuming your attention. And you miss that the surgeon said, oh, by the way, you can't run, you shouldn't be lifting weights beyond this amount, and you're not gonna be able to bend your knees this far, and they're giving you all the limitations. And people, I find that I see people after they've had a knee replacement because they still have problems, or their other knees hurting them now and they don't want to go through that again with the knee replacement. And they're stunned oftentimes, saying things like, the surgeon never told me that I couldn't do this anymore. I'm worried about dancing. I can't even getting intimate with my partner. I can't bend my knee this way. I can't do things like that. You have all these limitations on that you didn't expect. And people wish they would have gotten the surgery to begin with. And then when they learn about our process, this whole process that I'm explaining, how it's multiple steps, then they realize, oh, maybe I should have gone through that before agreeing to the surgery. Even if you had to have the surgery, like even if our process didn't work out, which happens every once in a while, there is a case that's just too far gone and they need surgery. But if you go through that process of figuring out which muscles to fire, making sure that you're strengthening your muscles properly, then you're set up to recover way faster from your surgery, and you're more likely to get a better outcome from the surgery because you would have fixed the root muscle imbalance that often causes people problems anyway after they have the knee replacement, because they still carry over that muscle imbalance with them. So this is important. Going back to the mainstream treatments, you're probably not improving because you're thinking that the injection is going to fix it. You're thinking the medication is going to fix it. You may be thinking about having the surgery, but it's not going to fix it either 100%. And then going through regular physical therapy, the chances are slim that you're going to find a therapist that's going to know what to do. I'm not saying it's impossible. We definitely have patients that get in touch with us, clients who we're working with online that say, I found a great therapist, I'm getting better. Fantastic if you can find that and if it works for you. That's the route to go. But I find most of the time, physical therapists are not excellent at helping people recover from a problem naturally like this, an arthritis problem. And what they'll do is punt to the surgeon. They'll run you through your course of physical therapy and say, you know what, it's not working out, you're swelling, I'm making you do all these exercises and you're just getting worse. Your surgical case, I'm gonna send you back to the surgeon. And the surgeon's happy to have you, right? They're like, well, we tried physical therapy, didn't work. Let's go ahead and set up a surgical date. And really, you were just at the wrong therapist. You're at the wrong specialty. You need to get to a place that can treat you well, or do a program like ours, like the Knee Arthritis Recovery Program, and that's an excellent place to start as well.